Welcome back to the final round here on Yahoo Finance. The daily coronavirus case count hitting the highest number that we have seen since July. 6 states recording their highest totals ever. So for more on this, we want to bring in Dr. Amesh Adalja. He is a senior scholar at the Johns Hopkins University Center for Health Security. And Dr. Adalja, great to have you back on the program. This case count continues to climb. I'm just curious, just as we try to gauge where we are in this pandemic, what does this tell you just about where we stand? Are the worst days still ahead of us?
I do think that some of the worst days may be ahead of us because we know that this virus is only going to intensify its transmission as it gets colder. It's less sunny, less humid. People can do more things only indoors versus outdoors, and the virus will intensify its transmission. Couple that with pandemic fatigue and people wanting to get back to some semblance of their life, we have to be prepared to see more cases and hear about hospitals getting into trouble again, like we're hearing about in Wisconsin and Utah and North Dakota.
Yeah, speaking of hospitals getting into trouble, because usually those upticks in hospitalizations lag behind the rise that we see and the number of cases. And like you said, we already are seeing some hospitals, at least at this point, at or near capacity. Some are having to turn patients away. How prepared are hospitals to deal with the surge that we're seeing right now, or better prepared, I should say, the second time around, because some of them are already near capacity?
It's a hodgepodge across the country. So if you're looking at a metropolitan area like New York or where I'm talking to you from in Pittsburgh, they're fairly well prepared and can deal with it when they've got big academic medical centers that have been thinking about this problem. But if you're talking about a rural place in North Dakota, the hospital preparedness is probably very spotty. Hospital preparedness is something that is not well prioritized by hospitals, by funding agencies. So this is something that really is going to be challenging for many hospitals. And I do think that many places didn't do the work during the time that we had this lull, or where they weren't inundated. They weren't building up their hospital capacity. They weren't thinking about how they're going to deal with the surge. I think there was a lot of magical thinking going on that this wasn't going to happen, or somehow that our worst days were ahead. This is a long pandemic, and it is a marathon, not some kind of a sprint. So we're going to have to continue to make sure that our hospitals are in a good position, or we will run into problems with mortality rates going up, not just for COVID, but for other conditions as well, as hospitals are stressed and can't deliver care in a good way.
Doctor, we saw the FDA approve Gilead's remdesivir as treatment for the coronavirus.